Okay, let's talk Alarplasty. When I started doing Alarplasty 15-20 years ago, I had to learn a lot of new stuff. It was not something that was really defined, developed, and it was still evolving. It continues to evolve. And along the way, I learned a lot of things. Back then, even the word Alarplasty was not used very frequently. It was nostril narrowing, nostril reduction, weir excisions, and now over time, it is becoming a mainstream word, Alarplasty. So that's great. But as we go on, we learn some lessons. I want to share my experience and my lessons with everybody, meaning the patients and the surgeons alike, so we can minimize the complications, which do happen, will happen, so we have to do our best to prevent it and to bring it to the next level, make it even better for everyone. So, as you know, I can't remember anything, so I use mnemonics. What have I learned? BINSS. When you have thoughts, you put them in the bins. B-I-N-S. S, quite a few bins. So let's start. B. B is for breathing. When you have wide nostrils and you breathe, you get a lot of air going in, and that's fantastic. When you narrow it, it will reduce. The reality is, in majority of the cases, it really does not become noticeable unless you overdo and pinch it, or you have underlying breathing issues to begin with. So be careful. Next, B-I-N-S, I. I is the most important part. Now, not about me, not I, though not that I. I about irreversibility. It is an irreversible procedure if you overdo it. It's really impossible to fix it without significant scarring. If you underdo and you go back, yes, you can manage to take more. But if you overdone it, or you made a big mistake, it is irreversible. So please be very, very careful. Next, N. N stands for, no, not the nose, but pretty close. Nasolabial groove, which is the smile line right here. The superior most, the upper part of the nasolabial groove right here, which is part of the alar groove almost, has a triangle-like area. It's well hidden, but when you move the nostril away, this opens up right here. It doesn't look bad, but it brings attention to this area for some people, and then they get a little bit kind of focused on it. It's like, oh my God, I never had this. So keep in mind, this will open up, not in a bad way, but I just want you to be aware. So that's the nasolabial groove part. B-I-N-S. S for scarring. You know, anytime you make an incision on skin anywhere, there will be a scar. Not like an ugly scar, but there's some scarring. And the thicker the skin, the more sebaceous the skin, more likely to have some scarring. So you have to kind of accept that. So that is part of it. And after that, the last and not the most important, I would say second most important after irreversibility, symmetry. It is impossible to get 100% symmetric nostrils. And if you try to correct the asymmetry, as a surgeon, what happens is you take a little more from one side and then you realize, maybe the other side needs a little more. And then you go from there to the next, and guess what happens? You keep taking. I don't think you want that. Yes, you don't want that. So remember, whenever you're doing Alarplasty or getting Alarplasty, BINSS. B for breathing issues, I for irreversibility, N for the nasolabial groove opening up here, S for scarring, and S for symmetry. Stop looking at your nostrils from below. Who does that? If you feel somebody comes and looks from underneath like that, smack them. He shouldn't be that close to you. Peace and Alarplasty.